Question 1. What is the primary purpose of an RBT engaging in ongoing training and supervision? A. To earn more money. B. To maintain and improve competency in implementing behavior plans. C. To socialize with other professionals. D. To get assigned more clients. Answer B. To maintain and improve competency in implementing behavior plans. This question is testing your understanding of the RBT credential requirements and the importance of professional development. The keyword primary purpose asks about the main reason for continued training and supervision. Ongoing training and supervision are essential parts of the RBT role because they ensure you are always learning, staying up to date with best practices, and getting support to implement plans effectively and correctly. This helps you provide the best possible service to your clients and keeps your skills sharp. For example, your supervisor might show you a new way to prompt a skill or help you troubleshoot a difficult behavior challenge. Remember, continuous learning and supervision are all about becoming a better RBT and helping your clients more effectively. Question 2. When collecting ABC data, the B stands for A. Before. B. Behavior. C. Background. D. Belief. Answer B. Behavior. This question is asking about the components of ABC data collection, a fundamental skill for RBTs. The letters ABC are a standard way to organize information about challenging behaviors. The B specifically refers to the behavior itself, what the person did that you are observing and tracking. Collecting this data helps you understand the context of the behavior. What happened right before it, the antecedent, and what happened right after it, the consequence. For instance, if a child screamed, the scream is the behavior you would record. Thinking about ABC data is like being a detective, trying to figure out the pattern of the behavior. Question 3. What is positive reinforcement? A. Giving something a client dislikes to decrease a behavior. B. Taking away something a client dislikes to decrease a behavior. C. Giving something a client likes to increase a behavior. D. Taking away something a client likes to increase a behavior. Answer C. Giving something a client likes to increase a behavior. This question is about positive reinforcement, a core concept in ABA. The term reinforcement always means the behavior that happened right before is going to become more likely in the future. Positive means you are adding something, like a toy, praise, or a preferred activity. After the behavior occurs, the goal is to make that good behavior happen more often. For example, if a child says, please, and you immediately give them the toy they want, and they say please more often in the future, that's positive reinforcement. Think of it like adding something good to make the behavior stronger. Question 4. Which of the following is an example of discontinuous measurement? A. Counting every time a behavior occurs within an observation period. B. Timing how long a behavior lasts. C. Recording if a behavior occurred at any point during an interval. D. Recording the time between responses. Answer C. Recording if a behavior occurred at any point during an interval. This question is asking about different ways RBTs measure behavior, specifically identifying a type of discontinuous measurement. Discontinuous measurement doesn't capture every single instance of the behavior or its full duration. Instead, it involves observing during specific periods or at certain moments. Recording if a behavior happened at all within an interval, even if it happened multiple times or for a long time, is a form of interval recording. Like partial interval, which is discontinuous because you aren't counting every single occurrence or the exact length. Continuous measurements, like counting every instance, frequency, or timing duration, capture every bit of the behavior. A good way to remember is that discontinuous measurement gives you an estimate, while continuous measurement gives you the full picture of the behavior. Question 5. When fading a prompt, you should A. Remove the prompt immediately. B. Gradually reduce the strength of the prompt. C. Increase the strength of the prompt. D. Use a different prompt every time. Answer: B. Gradually reduce the strength of the prompt. This question is about prompt fading, which is a technique used in skill acquisition. A prompt is a hint or extra help you give a client to get them to perform a skill correctly. Fading means slowly taking that help away so the client can eventually do the skill on their own without any hints. You do this by making the prompt less obvious or intense over time. For example, if you are teaching a child to point to a picture of a dog and you started by tapping the picture, a physical prompt, you might next just gesture towards it, a gestural prompt. Then maybe just look at it, and finally provide no prompt at all. The key is gradual removal to help the client become independent. Question 6. What is the primary ethical responsibility of an RBT regarding client confidentiality? A. To share client information with family members only. B. To discuss client information freely with colleagues. C. To protect client information and only share it with authorized individuals as necessary for treatment. D. To post about client progress on social media, anonymously. Answer: C. To protect client information and only share it with authorized individuals as necessary for treatment. This question focuses on a critical ethical responsibility for RBTs, protecting client privacy, also known as confidentiality. Confidentiality means keeping sensitive information private. As an RBT, you will learn a lot about your clients and their families, and it is your ethical and legal duty to keep that information secure. You should only discuss client information with your supervisor or other team members directly involved in the client's treatment, and only when necessary for their care. You should never share specific client details with unauthorized people, post about them online. Even if you don't use their name, details can be identifying, or discuss them in public places where others might overhear. Keeping client information private builds trust and respects their rights. Question 7. Which type of graph is most commonly used in ABA to display behavior data over time? A. Bar graph. B. Pie chart. C. Line graph. D. Scatter plot. Answer: C. Line graph. This question asks about the standard way RBTs and BCBAs visually represent behavior data. While other graphs exist, the line graph is the workhorse of ABA because it is excellent at showing how a behavior changes over time. You plot data points like frequency, duration, or percentage for each session or day, and connecting the dots with a line clearly shows trends. Is the behavior increasing, decreasing, or staying the same? This visual representation helps the team quickly see the effect of interventions. Think of it like tracking progress on a chart. The line shows the path of change. Question 8. An S-delta, S, is a stimulus that signals that a behavior will A. Be reinforced. B. Not be reinforced. C. Be punished. D. Automatically occur. Answer: B. Not be reinforced. This question is about discriminative stimuli, which are signals in the environment. We often talk about an SD, which signals that reinforcement is available if a specific behavior occurs. An S-delta, S-delta, is the opposite. It's a stimulus that signals that if you perform a particular behavior in its presence, that behavior will not be reinforced. For example, if you teach a child to say ball when they see a ball, SD for saying ball, then showing them a shoe would be an S-delta for saying ball, because saying ball in the presence of a shoe wouldn't get reinforced. You wouldn't give them a ball or praise for that. It tells you when not to do a specific behavior if you want reinforcement. Question 9. What is the purpose of a functional assessment? A. To determine the client's academic skills. B. To identify the purpose or function of a behavior. C. To assess the client's communication abilities. D. To measure the duration of a behavior. Answer: B. To identify the purpose or function of a behavior. This question asks about the goal of a functional assessment, which is a process used to understand why a challenging behavior is happening. The keyword function in ABA refers to the purpose the behavior serves for the individual. Behaviors happen because they work for the person in some way. They get attention, escape a task, get a tangible item, or provide sensory stimulation. A functional assessment involves collecting data, like ABC data, interviewing people, and sometimes directly testing things out to figure out what the client gets out of doing the behavior. Knowing the function is crucial because interventions are designed to teach a replacement behavior that serves the same function in a more appropriate way. Question 10. When you provide reinforcement after a fixed number of responses example, every 5 correct answers, you are using which type of reinforcement schedule? A. Fixed interval, FI. B. Variable interval, VI. C. Fixed ratio, FR. D. Variable ratio, VR. Answer: C. Fixed ratio, FR. This question is about schedules of reinforcement, which determine when a behavior gets reinforced. The terms fixed and variable refer to whether the requirement stays the same or changes. Ratio and interval refer to whether reinforcement depends on the number of responses, ratio, or the passage of time, interval. In this case, reinforcement is given after a fixed number of responses example every 5, which perfectly describes a fixed ratio schedule. For example, giving a child a sticker for every 3 puzzles they complete is an FR3 schedule. Fixed ratio schedules often lead to a high rate of response with a pause right after reinforcement. Question 11. Which term refers to breaking down a complex skill into smaller, manageable steps? A. Shaping. B. Chaining. C. Pairing. D. Generalization. Answer: B. Chaining. This question is about teaching complex skills, and the keyword is breaking down a complex skill into smaller, manageable steps. This process is called chaining or task analysis. When you want to teach a skill like washing hands or brushing teeth, you don't teach it all at once. You break it down into a sequence of smaller steps that the person can learn one by one. And when linked together, they make up a whole skill. For example, washing hands might be: turn on water, wet hands, get soap, rub hands, rinse, turn off water, dry hands. Each step is taught in order to build the entire chain. Question 12. What is the primary role of an RBT in the behavior intervention plan, BIP? A. To develop the BIP based on assessment data. B. To implement the BIP as written by the supervisor. C. To modify the BIP based on client progress. D. To supervise other RBTs implementing the BIP. Answer: B. To implement the BIP as written by the supervisor. This question clarifies the specific role of an RBT regarding behavior intervention plans. While RBTs are crucial members of the team and contribute valuable data, their primary role is not to create, modify, or supervise others on the plan. The behavior analyst, BCBA or BCBA, is responsible for developing and changing the BIP based on assessments and data. The RBT's main job is to follow the plan precisely as instructed by their supervisor. This ensures consistency and that the plan is implemented correctly to help the client. You are the boots on the ground, putting the plan into action. Question 13. When documenting your session notes, it is important to be: A. Opinionated and subjective. B. Vague and brief. C. Objective and factual. D. Emotional and personal. Answer: C. Objective and factual. This question is about the importance of professional and accurate documentation for RBTs. Your session notes are legal documents and are used by the clinical team to make decisions. Being objective and factual means describing only what you observed and heard, without adding your opinions, feelings, or interpretations. Instead of writing "client was angry," you would write "client frowned, yelled loudly, and threw the toy." This helps ensure everyone understands the situation accurately based on observable events, not personal feelings. Good documentation is clear, accurate, and based purely on observation. Question 14. Which term describes when a learned skill or behavior occurs in new situations or with new people? A. Discrimination. B. Generalization. C. Extinction. D. Punishment. Answer: B. Generalization. This question is about a key outcome we aim for in ABA: generalization. Generalization happens when a client learns a skill or behavior in one specific situation, like saying ball when shown a picture of a ball with their therapist, and can then use that skill or behavior in different situations, with different people, or with different materials, like saying ball when they see a real ball outside, or with their parent, or even describing a round object as like a ball. It means the learning isn't stuck in just one place. It's spreading to other relevant parts of their life. We want skills to be useful everywhere. Question 15. What should you do if a client's parent asks you for clinical advice about their child's diagnosis or medication? A. Provide them with your personal opinion. B. Suggest they look up information online. C. Politely explain that you are an RBT and not qualified to provide that type of advice, and recommend they speak with their doctor or BCBA supervisor. D. Give them the information you learned in your RBT training. Answer: C. Politely explain that you are an RBT and not qualified to provide that type of advice, and recommend they speak with their doctor or BCBA supervisor. This question addresses the ethical boundaries and scope of practice for an RBT. As an RBT, you work under the supervision of a BCBA or BCABA, and you are trained to implement behavior plans, not to give medical advice, diagnose conditions, or make clinical decisions about treatment approaches beyond the scope of your plan. When asked questions outside your expertise, it's crucial to acknowledge the question, state your role and its limitations clearly but kindly, and direct the person to the appropriate professional, like the BCBA, the client's doctor, or other specialists. This protects the client, the family, and yourself by staying within your defined role. Question 16. If a behavior decreases because a preferred stimulus was removed following the behavior, this is likely an example of A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: D. Negative punishment. This question is about punishment, which is a consequence that makes a behavior less likely to happen in the future. Punishment always decreases behavior. Negative means something is removed or taken away after the behavior occurs, so negative punishment means taking away something the person likes, a preferred stimulus, which results in the behavior happening less often in the future. For example, if a child throws a toy, behavior, and you immediately take the toy away for a few minutes, removing a preferred stimulus, and the child is then less likely to throw toys in the future, that's negative punishment. Think of negative as subtracting something. Question 17. Which term describes a prompt that involves helping the client physically complete the behavior? A. Verbal prompt. B. Gestural prompt. C. Model prompt. D. Physical prompt. Answer: D. Physical prompt. This question asks about types of prompts used to help clients learn new skills. Prompts are hints that guide the learner to make the correct response. A physical prompt is when you physically guide or help the client perform the action. This can range from full physical guidance, hand-over-hand help, to partial physical guidance, lightly touching an elbow to guide a movement. Other prompts include telling them what to do, verbal, pointing, gestural, or showing them what to do, model. Physical prompts are often used for motor skills like writing or dressing. Question 18. What should you do if you suspect abuse or neglect of a client? A. Discuss your concerns with the client's family first. B. Wait until you are certain before reporting. C. Report it immediately to your supervisor and the appropriate authorities as required by law. D. Ignore it unless the client tells you directly. Answer: C. Report it immediately to your supervisor and the appropriate authorities as required by law. This question covers a critical ethical and legal responsibility for RBTs and all mandated reporters, responding to suspected abuse or neglect. As an RBT, you are likely a mandated reporter, meaning you are legally required to report any suspicion of abuse or neglect. You do not need to investigate or be certain. Suspicion is enough. The correct action is always to follow your company's policy, which typically involves reporting immediately to your supervisor, and then, as required by law, to the relevant child or adult protective services. Protecting vulnerable individuals is paramount. Question 19. What is a baseline? A. The point at which the client masters a skill. B. The level of behavior before an intervention is implemented. C. The reinforcement schedule used during intervention. D. The criteria for ending a session. Answer: B. The level of behavior before an intervention is implemented. This question asks about the concept of a baseline in data collection. Baseline data is collected before you start a new intervention, either trying to increase a good behavior or decrease a challenging one. It shows you how often, how long, or how intensely the behavior was happening naturally without any specific plan in place. This initial data is super important because it gives you a point of comparison to see if your intervention is actually working. If the behavior changes after you start the intervention, you can compare it to the baseline to see if the intervention had an effect. It's your starting point on the graph. Question 20. Which term refers to teaching a behavior until it occurs independently without prompts? A. Fading. B. Shaping. C. Discrimination. D. Maintenance. Answer: A. Fading. This question is about getting the client to perform skills on their own. While other options are related to skill acquisition, fading specifically refers to the process of gradually reducing and eventually eliminating prompts that were used to help the client perform the behavior. We provide prompts initially to ensure the client can respond correctly and access reinforcement, but the ultimate goal is for the behavior to be controlled by the natural environment or the relevant SD, not the prompt. Fading is how we make prompts disappear, helping the client become independent. Question 21. What is the main purpose of collecting data in ABA? A. To prove that the RBT is working hard. B. To make graphs for the supervisor. C. To make informed decisions about treatment and evaluate progress. D. To determine if the client likes the RBT. Answer: C. To make informed decisions about treatment and evaluate progress. This question asks about the fundamental reason RBTs collect data. Data collection is not just busywork, it's the cornerstone of ABA. We collect data to have objective information about how the client's behavior is changing. This data helps the BCBA determine if the intervention plan is effective, if modifications are needed, and whether the client is making progress towards their goals. It takes the guesswork out of treatment decisions and allows for evidence-based practice. Your data helps the team understand what's working and what isn't. Question 22. Which reinforcement schedule is most resistant to extinction once a behavior has been learned? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Continuous reinforcement, CRF. Answer: B. Variable ratio, VR. This question is about how different reinforcement schedules affect behavior persistence, especially when reinforcement stops. Extinction. A variable ratio schedule means reinforcement is given after a variable or changing number of responses. Think of slot machines. You never know which pull will win, but you know eventually one will. This unpredictability makes people keep trying even when they haven't been reinforced for a while because they think the next response could be the one. This makes behaviors learned on VR schedules very resistant to extinction compared to the others. Continuous reinforcement. Getting reinforced every time. leads to fast learning, but also fastest extinction when reinforcement stops. Question 23. What is extinction in ABA? A. Teaching a new appropriate behavior. B. Providing reinforcement for a different behavior. C. Withholding reinforcement for a previously reinforced behavior. D. Applying a consequence to decrease a behavior. Answer: C. Withholding reinforcement for a previously reinforced behavior. This question is about extinction, a procedure used to decrease challenging behavior. Extinction involves identifying what is reinforcing the behavior and then stopping that reinforcement. If a behavior no longer gets the payoff it used to get, it will likely decrease over time. For example, if a child used to get attention, reinforcement, every time they whine to get a toy, putting the behavior on extinction means you stop giving attention, withholding reinforcement, when they whine. It's important to know that extinction often leads to an extinction burst, where the behavior temporarily gets worse before it gets better, and sometimes new behaviors might appear. Question 24. An RBT is working with a client who throws toys. The BCBA creates a plan that involves giving the client attention when they are playing appropriately with toys and removing attention when they throw toys. This is an example of A. Differential reinforcement. B. Punishment. C. Shaping. D. Prompting. Answer: A. Differential reinforcement. This question describes a common behavior reduction strategy called differential reinforcement. Differential reinforcement means you are reinforcing one behavior while withholding reinforcement, extinguishing another behavior. In this example, you are reinforcing the desired behavior, playing appropriately, while putting the challenging behavior, throwing toys, on extinction by removing attention. This teaches the client a better way to get reinforcement, attention, than the challenging behavior. It's like saying, you get the good stuff for doing this, but not for doing that. Question 25. What is the purpose of conducting a preference assessment? A. To identify the function of a challenging behavior. B. To teach a client how to make choices. C. To determine potential reinforcers for a client. D. To measure the frequency of a behavior. Answer: C. To determine potential reinforcers for a client. This question asks about preference assessments, a crucial first step in setting up effective reinforcement strategies. A preference assessment is simply a way to figure out what items, activities, or social interactions a client likes or prefers at a given time. By seeing what they choose or respond enthusiastically to, you get ideas for things you can use as potential reinforcers, rewards, to motivate them during teaching or for exhibiting desired behaviors. Knowing what a client likes makes reinforcement powerful. It's all about finding what makes the client tick. Question 26. If a client is learning to imitate actions and the RBT models clap hands, what kind of prompt is the RBT providing? A. Verbal prompt. B. Gestural prompt. C. Model prompt. D. Physical prompt. Answer: C. Model prompt. This question describes a specific type of prompt. A model prompt is when you show the learner exactly what you want them to do by performing the behavior yourself. In this case, the RBT performs the action, clap hands, that the client is expected to imitate. This provides a clear example for the client to copy. Other prompts involve telling, verbal, pointing, gestural, or physically assisting, physical. Question 27. When should an RBT update their session notes? A. Only at the end of the week. B. As soon as possible after the session is completed. C. Only when a challenging behavior occurs. D. Before the session begins. Answer: B. As soon as possible after the session is completed. This question emphasizes the importance of timely documentation. It's best practice to complete your session notes right after the session ends, while the details are fresh in your mind. Waiting too long can lead to forgetting important information or mixing up details from different sessions. Accurate and timely notes are essential for communication with your supervisor and the rest of the team, ensuring continuity of care and accurate data. Don't delay your documentation. Question 28, which is the best example of a clearly defined, observable, and measurable behavior. A. John was angry. B. Mary felt sad. C. David slammed the door. D. Sarah seemed frustrated. Answer: C. David slammed the door. This question is asking you to identify a behavior described in a way that you can actually see and count it. In ABA, we define behavior by what it looks like or sounds like, not by internal feelings or interpretations. Slammed the door is something you can see and hear. You can count how many times it happens. The other options describe internal states: angry, sad, frustrated, that aren't directly observable behaviors. We need to define behavior clearly so that anyone observing it knows exactly what to look for and can measure it consistently. Question 29. What should an RBT do if they are unsure how to implement a new behavior plan or skill acquisition program? A. Guess based on previous experience. B. Ask the client's parent for instructions. C. Immediately contact their BCBA supervisor for guidance. D. Look it up online. Answer: C. Immediately contact their BCBA supervisor for guidance. This question addresses the crucial role of supervision and seeking help when needed. It is absolutely essential for an RBT to work under close supervision and never implement something they don't fully understand. If you receive instructions for a new plan or program and you are not confident about how to run it, your ethical responsibility and best practice is to stop and ask your supervisor for clarification and training before you try to implement it with the client. This ensures the plan is implemented correctly and safely. When in doubt, reach out to your supervisor. Question 30. When teaching a skill using discrete trial training, DTT, a single trial consists of A. Only the client's response. B. Antecedent, behavior, and consequence. C. The RBT's instructions only. D. Only the reinforcement provided. Answer: B. Antecedent, behavior, and consequence. This question describes the basic structure of a discrete trial, which is a common teaching method in ABA, especially in structured settings. A discrete trial has a clear beginning and end and follows an ABC pattern, just like collecting data. The antecedent is the instruction or cue given to the client example, touch your nose. The behavior is the client's response example, touching their nose. The consequence is what happens immediately after the behavior example reinforcement, if correct, or a specific procedure if incorrect. Understanding this structure helps you run teaching trials consistently. Question 31. If a client engages in a challenging behavior and the RBT provides attention, and the behavior increases in the future, attention served as A. Punisher. B. Extinction burst. C. Reinforcer. D. Prompt. Answer: C. Reinforcer. This question is an example of identifying the effect of a consequence. The key phrase here is the behavior increases in the future. Anything that follows a behavior and makes that behavior more likely to happen again is a reinforcer. In this scenario, the attention provided by the RBT happened after the challenging behavior, and because the behavior increased, we know that attention was functioning as a reinforcer for that client in that moment. This is why collecting ABC data is so important. It helps us see these relationships. Question 32. Which ethical principle emphasizes treating clients with dignity and respect? A. Beneficence, doing goody. B. Fidelity, being truthful. C. Autonomy, respecting choices. D. All of the above. Answer: D. All of the above. This question touches upon the core ethical principles that guide ABA practitioners. While each term has a specific meaning, the overarching theme of ABA ethics is to act in the client's best interest, which absolutely includes treating them with dignity and respect. Beneficence means working for the client's benefit and well-being. Fidelity involves being honest and trustworthy. Autonomy means respecting the client's choices and involving them in decision-making to the extent possible. All these principles combined underscore the importance of treating every client as a valued individual with rights and deserving of respectful treatment. Question 33. When taking frequency data, you are recording. A. How long a behavior lasts. B. How many times a behavior occurs. C. If a behavior occurred within an interval. D. The intensity of a behavior. Answer. B. How many times a behavior occurs. This question asks about frequency, a common type of continuous measurement used by RBTs. Frequency simply means how often something happens. When you take frequency data, you are literally just counting each time the specific behavior occurs within an observation period. For example, counting how many times a child raises their hand in class, or how many times they say a specific word. Duration measures how long it lasts, and interval recording knows if it happened within a time block. Frequency is just about the count. Question 34. What is meant by the term pairing in ABA? A. Pairing a challenging behavior with a consequence. B. Pairing yourself or the learning environment with reinforcement. C. Pairing two clients together for social skills training. D. Pairing a prompt with a target behavior. Answer. B. Pairing yourself or the learning environment with reinforcement. This question asks about pairing, which is a foundational strategy, especially when starting with a new client. Pairing means associating yourself, your presence, or the therapy setting with positive reinforcement. You want the client to see you and the learning environment as sources of fun, preferred items, and positive interactions. By consistently providing reinforcement and enjoyable experiences when you are present, you build a positive relationship and make the learning environment motivating. This helps the client want to be with you and participate in activities. Make yourself and learning enjoyable. Question 35. What is the primary characteristic of a tantrum behavior from an operational definition standpoint? A. It makes the client feel better. B. It involves crying, screaming, and slash or throwing items. C. It is used to get attention. D. It is challenging for the therapist. Answer. B. It involves crying, screaming, and slash or throwing items. This question is about defining behavior in a way that is objective and observable, known as an operational definition. When defining a behavior like a tantrum, you need to describe exactly what it looks and sounds like. The other options describe potential feelings, functions, or effects on others, which are not part of the observable definition of the behavior itself. An operational definition allows different people to observe the same behavior and agree on whether or not it occurred. So, describing the specific actions like crying, screaming, and throwing is the observable part of the definition. Question 36. When teaching a client to follow instructions, the instruction given by the RBT is the A. Consequence. B. Behavior. C. Antecedent. D. Reinforcer. Answer. C. Antecedent. This question relates back to the ABC model. The antecedent is what happens immediately before the behavior you are interested in. In a teaching trial for following instructions, the instruction given by the RBT example, touch nose, sit down, is the trigger or cue that you expect the client to respond to. The client's response, touching nose, sitting down, is the behavior, and what happens after that, reinforcement or correction, is the consequence. Question 37. What is the purpose of using a visual schedule with a client? A. To provide a form of punishment. B. To make the day unpredictable and exciting. C. To provide structure, predictability, and help with transitions. D. To replace verbal instructions entirely. Answer: C. To provide structure, predictability, and help with transitions. This question asks about visual schedules, a common support tool in ABA. A visual schedule uses pictures, words, or symbols to show a client the sequence of activities or events that will happen during a period of time. This provides clear structure, helps the client understand what to expect, predictability, and can significantly reduce anxiety around moving from one activity to another. Transitions: it helps the client know first this, then that. It's a way to make the daily routine clear and manageable. Question 38. If a client learns to say juice when they see a picture of juice and then says juice when they see a real cup of juice or a juice box, this is an example of A. Discrimination, B. Shaping, C. Generalization, D. Prompting. Answer: C. Generalization. This question describes a client using a learned skill, saying juice, in different but related situations. Seeing a picture of is seeing a real cup/box. This is a perfect example of generalization, where the learned behavior occurs under different conditions than those where it was originally taught. We want skills to generalize so clients can use them functionally in their everyday lives, not just in therapy sessions with specific materials. Question 39. What does AIPAA stand for, and why is it important for RBTs? A. Health Information Privacy Act. It dictates how RBTs should store data. B. Healthcare Insurance Portability and Accountability Act. It protects client health information privacy. C. Health Industry Professional Association. It provides guidelines for ethical conduct. D. Helping individuals progress academically. It guides curriculum development. Answer: B. Healthcare Insurance Portability and Accountability Act. It protects client health information privacy. This question tests your knowledge of AIPAA, a federal law critical for anyone working in healthcare, including ABA. AIPAA is all about protecting the privacy and security of individuals' health information. As an RBT, you will handle sensitive client data, and you must follow AIPAA regulations to ensure this information is kept confidential and only shared with authorized individuals for necessary purposes, like treatment or payment. Knowing and following AIPAA is a legal and ethical requirement to protect your client's privacy rights. Question 40. When conducting a free operant preference assessment, the RBT. A. Asks the client what they want. B. Offers choices 2 at a time. C. Systematically presents items 1 at a time. D. Observes what the client chooses to interact with when given access to many items. Answer: D. Observes what the client chooses to interact with when given access to many items. This question is about a specific type of preference assessment called a free operant assessment. In a free operant assessment, you don't require the client to make a specific choice from a forced selection. Instead, you arrange several potential items or activities in the environment and simply observe which ones the client freely approaches, interacts with, and spends time with, without any demands or instructions. This can give a very naturalistic indication of what the client prefers at that moment. Question 41. What is an antecedent intervention? A. A strategy implemented after a behavior occurs. B. A strategy implemented before a behavior occurs to prevent it or make appropriate behavior more likely. C. A way to measure behavior frequency. D. A type of reinforcement schedule. Answer: B. A strategy implemented before a behavior occurs to prevent it or make appropriate behavior more likely. This question asks about antecedent interventions, which are proactive strategies used in behavior plans. Remembering the ABC model helps here. The antecedent is what happens before the behavior. Antecedent interventions involve changing something in the environment before a challenging behavior is likely to happen or before you want a desired behavior to occur. The goal is often to make the challenging behavior less likely or irrelevant, and the desired behavior more likely and easier. Examples include providing choices, using visual schedules, or modifying tasks. It's about setting the stage for success. Question 42. If you are implementing a behavior reduction plan that involves ignoring a client's whining behavior, which was previously reinforced by attention, you are likely using A. Positive reinforcement, B. Punishment, C. Extinction, D. Shaping. Answer: C. Extinction. This question describes the procedure of extinction. You identified that the whining behavior was happening because it was getting attention, reinforcement. The intervention involves withholding that previously delivered reinforcement, attention. When the whining occurs, this is the definition of putting a behavior on extinction. The goal is for the whining to decrease because it no longer serves its function of getting attention. Question 43. What is the purpose of a skill acquisition program? A. To reduce challenging behaviors. B. To teach new skills or increase existing appropriate skills. C. To assess client preferences. D. To manage crisis situations. Answer: B. To teach new skills or increase existing appropriate skills. This question asks about skill acquisition programs, which are a major part of an RBT's job. Skill acquisition literally means gaining skills. These programs outline specific goals and steps for teaching the client new abilities, whether they are communication skills, social skills, daily living skills, academic skills, or motor skills. They describe what to teach, how to teach it, using prompting, reinforcement, etc., and how to measure progress. While reducing challenging behaviors is also important, skill acquisition focuses on building positive abilities. Question 44. If a client throws a toy, behavior, and the RBT immediately takes away a preferred item the client was playing with, consequence, and this results in the client throwing toys less often in the future, this is an example of A. Positive reinforcement, B. Negative reinforcement, C. Positive punishment, D. Negative punishment. Answer: D. Negative punishment. This question is another example identifying a consequence procedure. The key is that the behavior, throwing a toy, decreased in the future, indicating punishment. The consequence involved taking away, negative, a preferred item. Taking away something good to decrease behavior is negative punishment. It's important to correctly identify whether something is being added, positive, or removed, negative, and whether the behavior increased, reinforcement, or decreased, punishment. Question 45. What should an RBT do if a client's behavior escalates to a level that the RBT cannot safely manage according to the behavior plan? A. Continue implementing the plan as written, even if unsafe. B. Leave the situation immediately. C. Use physical restraint, even if not trained or in the plan. D. Implement the safety crisis plan and contact their supervisor immediately. Answer: D. Implement the safety crisis plan and contact their supervisor immediately. This question addresses safety and emergency procedures, which are paramount for RBTs. If a client's behavior becomes unsafe and you cannot manage it using the standard behavior plan procedures, you must follow the specific safety or crisis plan designed for that client. This plan should outline steps to ensure safety and always includes contacting your supervisor right away for support and guidance. You should never use untrained procedures or put yourself or the client at unnecessary risk. Safety first, always, and contact your supervisor. Question 46. When you deliver reinforcement immediately after a desired behavior occurs, you are focusing on the principle of A. Generalization, B. Extinction, C. Immediacy, D. Shaping. Answer: C. Immediacy. This question highlights a critical factor that makes reinforcement most effective. delivering it immediately after the target behavior happens. The principle of immediacy states that the sooner the consequence, reinforcement, or punishment follows the behavior, the stronger the connection the learner makes between the behavior and that consequence. Waiting too long can accidentally reinforce a different behavior that happened later. To make learning efficient, deliver that reward or consequence right away. Question 47. Which scenario represents the RBT practicing within their scope of competence? A. Creating a new behavior plan for a complex behavior issue. B. Recommending specific medication to a parent. C. Implementing a task analysis program as trained by the BCBA. D. Diagnosing a developmental disorder. Answer: C. Implementing a task analysis program as trained by the BCBA. This question is about the RBT's scope of competence, meaning what you were trained and authorized to do. RBTs are trained to implement programs and plans designed by a BCBA or BCABA. Creating plans, recommending medication, and diagnosing are outside the RBT scope of practice and require advanced training and licensure. Implementing a specific program like a task analysis as trained by your supervisor is exactly what falls within the RBT's role. Stay within your lane of training and supervision. Question 48. What is duration data used to measure? A. The number of times a behavior occurs. B. The force or intensity of a behavior. C. How long a behavior lasts. D. The time between behaviors. Answer: C. How long a behavior lasts. This question asks about duration measurement, another type of continuous measurement. Duration is all about timing how long a behavior occurs from its beginning to its end. This type of measurement is useful for behaviors that last for varying periods of time, like tantrums, reading aloud, or engaging in play. If you were measuring how long a child reads independently, you would use duration recording. Frequency is for counting how many times, duration is for timing how long. Question 49. What is an essential component of responsible data collection for an RBT? A. Making up data if you miss a session. B. Collecting data inconsistently across sessions. C. Collecting data accurately and honestly as per the plan. D. Only collecting data on behaviors that are easy to measure. Answer: C. Collecting data accurately and honestly as per the plan. This question emphasizes the ethical and practical importance of accurate data collection. Reliable data is the foundation of effective ABA treatment. It is essential that RBTs collect data precisely as the plan instructs and record it honestly, even if the data doesn't show the progress you hoped for. Inaccurate or fabricated data can lead the clinical team to make incorrect decisions about treatment, ultimately harming the client. Your data needs to be a truthful picture of what happened. Question 50. Before starting a new skill acquisition program, the RBT should first ensure they understand: A. The target behavior definition. B. The teaching procedures, prompting, reinforcement. C. The data collection method. D. All of the above. Answer: D. All of the above. This question is a wrap-up on preparedness for implementing programs. Before you start teaching a new skill, it is absolutely crucial that you understand all the components of the program. You need to know exactly what the skill looks like, definition, how you are supposed to teach it step by step, procedures including prompts and how/when to reinforce, and how you need to track the client's progress. Data collection. If any piece is unclear, you must ask your supervisor before you begin. Being fully prepared ensures you can implement the program effectively and collect meaningful data.